People want to get this vaccine. They have seen people like Dr. J get it and how they are healthy and fine. People are getting confidence in the vaccine is growing. We are trying to move as many vaccines and get shots in arms as quickly as possible, and more people have that confidence and interest in getting the vaccine. And so I really believe that we need to continue ramping up. It would be great if we had the full-throated support and help from the federal government. In the interim, we will continue building up our systems. We're making great strides. But it is, I believe that so many of our teachers, our educators, our support staff in our schools are eager to get this vaccine, and that's why we've moved them into a phase where they can. I want to address one more thing before we end. I know you said that was the last question, but I'm going to just address something. I know that when you look at the website about how many vaccines have been received versus how many have been administered, it would, I think, looking at every state, you would recognize that this is a process that has to take a little bit of time. And I know everyone wants to see if you've got 500 shots, you've got 500 shots given. We are transporting, we are breaking down, we are working with local public health departments and hospital systems. And we've made incredible strides. As Dr. J said, we administered over 22,000 shots in the last 24 hours, I believe. It's close to that, if not. Is that about right?
24,000.
24,000. All right, I undersold that. But we're making great strides. And if you look at what's happening across the country, we have to have perspective here. Michigan is in the same situation as every other state. We're all building this up, and we're all at about the same level. So I want to be crystal clear. The state of Michigan has pushed out every single vaccine that we have received. We've pushed it out to eligible providers, our local public health departments, and our health systems. There are some recipients who have not gotten shots in arms, and we're giving technical assistance. We're offering the National Guard to assist so that we can get it done. This is a team effort, but we are getting these out and we are setting aggressive goals. We're getting about 60,000 vaccines a week from Pfizer. 100% of those vaccines are shipped out upon receipt. That's why we rank 5th highest in the nation when it comes to getting vaccines out the door. Those doses first went to our healthcare systems and local health departments to administer priority group 1A. Healthcare systems and local health departments have been requested to use their inventory within 7 days as of the last week, and they are also allowed to start with 1B populations, as we've articulated. Our daily shots in the arms have climbed considerably over the last week alone. That's the Pfizer vaccine. Now let's talk about the Moderna vaccine, because I know that this can be confusing, and I just want to walk through it. 100% of the Moderna vaccine, all of the Moderna vaccine, is shipped directly to CVS and to Walgreens to administer each week through 207 vaccinating locations. That vaccine does not come to the state of Michigan. It goes directly to CVS and Walgreens. So our daily shots in arms, when we total all of these up, is continuing to rise over 20,000 per day. We've got over 24,000 this week in one day. We have met with the CDC regularly. The frustration about their website is real, if you can feel it, but we're trying to get more pharmacies approved so that they can engage in the federal program, so that those allocated and unavailable doses of Moderna for long-term care facilities can get administered faster. We also have offered up Michigan National Guard as a partner. The City of Detroit will be getting almost 4,000 doses for their drive-through next week. They're doing a great job. We're excited about the work that they're doing. So in addition, the dashboard yesterday reflected the new higher number of doses received, 725,000, even though they came in batches over multiple days, which is part of the website issue. Yesterday it showed 550,000. So it is, it's an example of why that dashboard doesn't tell the whole story. So we still need a national strategy. I have been saying for months, whether it was around getting masks at the beginning or getting testing or an economic recovery or relief, and now vaccines, There still is not a national strategy. We're building this as states. We've made great strides. We have a list a mile long of distributors and people that want to help. We need to get more vaccines into the state of Michigan so that we can deploy them. And that's what we are working through. And that's what we are most, I think, looking forward to with the release of these Pfizer vaccines, whether it is soon under the Trump administration or in 12 days under the Biden administration. We'll be ready.